right, good afternoon, everybody. My name is Jen Wichman. I am the Director of Ward County Emergency Management, and thank you for coming to our COVID-19 local response press briefing. Today speaking, we have Lisa Clute from First District Health, Randy Schwan from Trinity Health, Susan Aguric from Job Service ND, John Feldall, Ward County Commission, Deborah Smested, Ward County Auditor Treasurer's Office, and Sean Sitma, City of Minot. And then I will wrap everything up. But first up, we have Lisa.
Good afternoon. Just want to take this opportunity to also thank the media that have been here every week, helping us get the message out, and we truly do appreciate this. So the update for the week is thus far we have conducted 3,356 tests within our 7 counties. We did 990 this past week. 327 of those were in rural counties outside of the Minot area, and we also had 9 additional cases this past week, 4 in Ward County, 2 in McLean, and 2 in Burke County, and 1 in Renville County. So of the 37 total cases in First District, so far 25 are recovered, and 14 were community transmission. So just to summarize very quickly, to date we have done 176 tests in Botno, and we have not had any positives. Go Botno. Burke, we have conducted 76 tests, and we have 5 positives. McHenry, there are 111 tests conducted with 1 positive. McLean, 454 tests and 5 positives. Renville, 54 tests were done and 1 positive. Sheraton, 24 tests, no positives. Go Sheridan. And Ward County, 2,461 tests and 25 positives. You hear a lot about testing these days, and we are very involved in testing. This past week, we have focused most of our efforts at First District at testing long-term facilities. Most of the long-term facilities, residents and healthcare providers in our area have been tested. There were a few more scheduled this week. As you are aware, with the governor's announcement, we have had delays in our testing and supplies. There is a backlog right now, and that is soon to be resolved. But because of that, most of the testing events were canceled for this week. I think all testing events were canceled this week. We were in the process of planning this past weekend for a mass testing event, and our intention was to, we anticipated 500 tests. We had prioritized healthcare workers and primarily healthcare workers as our focus group of those tests. And so we would anticipate that as that testing event is rescheduled, that would continue to be our next, or our group of priorities. We also look for who is most at risk of spreading the disease. And so obviously that is healthcare workers. Next is emergency responders. So we would be getting into that group as quickly as we could. So as mass testing events become available and we prepare for them, we certainly will let you know. We had anticipated that today we were going to be telling you that we had a test, or a mass testing event all ready to go. The way that works is that we plan for that event, and we receive confirmation 2 days prior to that event whether or not those tests will be here. So you plan, and then once you receive confirmation, then you can let the public know and proceed with that. So that is the way that works. We're often asked about sentinel testing or just drive-by testing. At this point, that doesn't look like that will be a priority in the state with the struggles that they are experiencing with test kits availability and so forth, and lab capacity. As soon as that is available, you can be assured that we will be requesting that. The process right now for arranging for those events is that local public health units, in working with emergency managers and so forth, put in requests for these events. They then are reviewed at the statewide level and then either approved or disapproved. Again, the priority groups continue to be the long-term healthcare workers, and residents, and healthcare providers, healthcare workers, and then emergency responders. So we will continue down that path and let you know as soon as we know of any events that we will be conducting. Excuse me. And I just used my hands to cover my cough, excuse me. So, First District has 16 staff that continue to do contact tracing. So as cases are identified, we have nursing staff that are working and monitoring those cases, and then once they are allowed to be released from that monitoring, they do that. So we also have environmental health that that have been busy, particularly this past weekend as we began some reopening across the district. So if you have questions, please feel free to call us. The environmental health staff are available, and if it's after hours, your call will roll to one of their phones and they will be available to answer any of those questions that businesses may have. Some of the requirements in the executive order some of the information that you receive from the state are recommendations and good recommendations, and some are an executive order that come with the force of law. One of the questions that we have received is what happens if people are over 50% capacity and so forth. Those are executive orders that do come with the force of the law, and they can be referred over to law enforcement. We continue to strongly recommend that all workers wear cloth face masks, and that businesses ask patrons to wear face masks and practice social distancing. It is a way of business for them to show their concern for their patrons and also a sign of respect for others. So each of us are going to be deciding how you want to proceed with this. And we want you to go out and support your local businesses, but it is ultimately an individual decision. So if you are not comfortable with that, if you have underlying health conditions, don't go. But if you continue to practice hand washing, good social distancing, and if we do this part of the reopening well, then we know that we can get into the phase 2 of reopening, and that's where we want to be. So, well, we want to be all the way open, but our next step is to get to phase 2. And so I encourage everybody, continue to be vigilant, practice good social distancing, wear your masks, wash your hands, wash your hands, wash your hands, and if you are comfortable and able to support those businesses that are opening, please do. And let's move on to phase 2. So, thank you.
Thank you, Lisa. Up next, we have Randy Schwann with Trinity Health, but not before we sanitize the podium, practicing that good hygiene.
Good afternoon. A few brief messages, and then I'll stand for questions, along with Dr. Jeff Sather, our Chief of Medical Staff, is with me today. But first, I wanted to give a final report on the testing that took place at Trinity Homes, our long-term care facility. Last week, we announced, along with First District Health, we had conducted mass testing at the long-term care facility and had gotten back just about all of the test results, but we did have a number of residents that had to be retested and a number of staff who had to be tested throughout the week because they weren't able to come in for that mass event. So reporting that the details are in and that all of the residents and all of the staff did come back negative. So go Trinity Homes. I wanted to remind that last week I announced that surgeries would once again take place this week. Elective surgeries, necessary surgeries, those elective surgeries that were important and needed to get on the docket for our patients. And they are resuming, and we are doing same-day surgeries now, and it's going very well. Folks are through our operating rooms, and we have implemented a number of safety steps to ensure protection for our staff and for the patients. I announced last week that we were also opening a respiratory clinic, and that indeed did happen. So we have a respiratory clinic that is off-site, that is strictly for those who are feeling respiratory symptoms. And so you'll call 857-7817 to get an appointment to that clinic. Whether you're positive or negative, it doesn't matter. If you have respiratory symptoms, that would be the clinic that you should go to. Secondly, that since that is off-site, our First Care walk-in, now call-in clinic is once again taking all folks who need a same-day appointment. Again, that number is 857-7817. So whether it's in-person visit for respiratory or non-respiratory symptoms or telehealth visits, so it's a visual, face-to-face electronic visit, those can be accomplished today. Make that call. For those who need an appointment with their provider, of course, you should contact your primary care provider at their office. Thought I'd go by the numbers. We have one COVID positive patient, inpatient now at Trinity Hospital. We also have a number of folks who are in the hospital with symptoms, COVID type symptoms, and we need, they've been tested and we are waiting the results of those tests. Whether they convert or not is something that we've been doing all along. Some of them will convert to positives perhaps, and most will not, but that's kind of the data that we have so far. We are still testing, of course, for COVID symptoms. If you need a test, wish a test, and have a symptom of any kind of COVID-19 symptom, please call that number, 857-7817, and we'll have you scheduled for an appointment at our drive-up clinic, and you'll be tested. We've done about 40 or so tests per day. Some days are heavier, some days we get above 50, and some days are lighter, depending on who calls. So far, I think we've had over 2,000 tests given. I want to remind you that the North Dakota Smart Restart certainly is embraced by a large segment of our economy. But in terms of healthcare access, you'll still be asked to wear a mask when you come to a clinic or the hospital, whether you're a patient, authorized guest, visitor. You're expected to bring your mask with you and wear it in the facility. You'll see our staff are wearing masks. And you'll be screened at the door for symptoms and directed based on the outcome of that screening. And just ask you to continue to wash your hands at all of our wash stations that are located throughout our facilities. If you're wondering about our visitor restrictions, I invite you to go to our website. We've outlined what they are currently, and we try to keep up to date with that. And I think that's all I have. So I'll stand by for questions.
All right, thank you, Randy. Up next, we have Susan with Job Service North Dakota.
Good afternoon. I'm going to start off with some numbers. From March 16th through May 4th, which was yesterday, there have been 71,281 regular unemployment insurance claims filed in the state of North Dakota. Along with that, there have been 10,240 PUA claims. Those are the claims that are for those that are self-employed, 1099 workers, gig workers, and those that do not qualify under regular unemployment. The PEUC claims, those are the claims for those people that are needing an extension for their regular unemployment. The number of claims that have been filed have been 10,937. With the reopening of businesses, many employees are returning back to work, but they may not be returning back to their regular or to their normal hours that they worked before they were furloughed or laid off. They should continue to certify. During certifying, a claimant will be asked if they have worked for any employer for the week they are certifying. If they answer yes, the system will then ask them to report their gross wages and the hours they worked that week. A claimant should always report the work they did the week they do the work, not the week they get paid for it. We encourage claimants to keep track of the hours that they work. Then you will multiply the hours that you worked by your hourly wage to input your gross wages into the system. The system will calculate whether you are eligible for a payment or not eligible. In our unemployment insurance claimant guide, there's a definition for what's called excess earnings. You can earn up to 60% of your weekly benefit amount without affecting your weekly benefit that you receive. Every dollar over that 60% mark is deducted dollar for dollar until you earn your weekly benefit amount. If your wages that you earn that week are higher than that weekly benefit amount, no payment will be issued for that week, and a claimant is responsible for working all available hours that the employer is requesting them to work. Give you a little bit of information on the PUA claims, the Pandemic Unemployment Assistance claims. They are being processed. The processing of those claims did start last week. Claimants that filed under the PUA need to sign into their UIICE account, click on the to-do list tab, and check the April calendar to see if there's a certified link for them to do. Some people may have to actually go back into March depending on when they filed their PUA claim. So they need to do this in order to certify. Certifying is what will release those payments. If they do not see anything on that to-do list, on that activity calendar, they need to call the Claims Center at 701-328-4995. They will need to wait for the prompt to ask a question, then they need to say question. If the system disconnects them, then it means there are too many people waiting in that queue call. They need to hang up and dial again, okay? Beginning tomorrow, Wednesday, May 6th, the Claims Center will have extended hours. They will be opening at 7:30 a.m. and will be open until 6 p.m. Please be patient. A number of the general and basic unemployment insurance questions can be answered by the local office, and our number is 857-7500. We also have a wait time. It has been decreasing. And I just want to thank our customers for the patience that they've had and the encouragement that they've provided us when they have called us and thanked us for all the work that we are doing. It is truly appreciated. Currently, our office is closed to the public. We are accessible by phone, the 857-7500. We are preparing for a June 1st reopening to the public, but customers will need to make an appointment to use our resource room and meet with our staff, and we will be providing more information at a later date. I will end with a reminder of our side of the system. and that is the reemployment side of job service. Indy Workforce Connection, which is accessed through our homepage of jobsindy.com. Employers continue to post jobs on our site, and there are quite a few jobs that are available. Just this morning when I searched our system, I saw a variety of positions from direct support professionals, professional positions in financial and healthcare, including the COVID medical positions with the North Dakota Department of Health that are here in Minot. Those are open and available. There are positions with the railroads, constructions, agricultural, maintenance, and food services, just to name a few. So if you are a unemployment insurance claimant that was not going back to that employer that laid you off, would highly recommend, to look in our system and start looking at the jobs that are available. So, thank you.
Thank you. Up next, we have John Feldall, Chairman of the Ward County Commission.
Thank you and good afternoon. Just a few things from the county's side of things. At today's morning meeting, it was decided by the commission to continue our current operating policies as is, which means certain buildings will still be locked and you have to call to get an appointment to get in. We did form a committee, and the committee will start working on changing the guidelines and changing our access to our buildings and how we bring our employees back into the buildings to serve the public. And we hope to have that recommendation to the full commission within less than 2 weeks. So look for a change in how we access our buildings that way. It is still, in talking to the state's attorney, it's still the ruling that jury trials will not begin till July 6th or later. And when that happens, 2 judges will be taking on the criminal trials simultaneously, and hopefully to get caught up a little bit. It'll take a little while to catch up on that, but that's the hope. Also, one of the topics that we adopted at our last commission meeting, which has brought a lot of phone calls to me and many others, including our emergency management, it's not necessarily COVID related, but seems like everything kind of is COVID related these days, has been our so-called burning ban and misunderstanding or misconception of what that means. And so I've taken quite a few calls, as well as our emergency manager, and trying to explain how this is supposed to work. This is not necessarily a burning ban. This is a ban rating system, or a burning rating system. And you can go on the state's website, you can go on our county emergency manager website. The state website address is www.nd/gov/DES/planning and /fire. Probably simpler to go on the county's website. She's going to have a web address on there to attach to that. I've taken that and recommended to many people that called. You can download a website, put it on your cell phone, and check that every day. They rate each county every day as far as what you can and can't do. And the motto what Jennifer and I talked about earlier today is if it's moderate or low, you're good to go, which means you can have a controlled burn if it's rated either moderate or low. There's 3 other ratings on there, some that have definitions of what types of other burns you can have, and of course the top one, which allows no burning. So we just wanted to reemphasize that to hopefully clear up some confusion. I'm a farmer, and many farmers, this is a big issue to them with our harvest, or lack of harvest last fall, and lots of burning that has to take place. And it also has concerned many city residents in the areas about why this burning's going on if there's so-called a burning ban. So that's about all I have, so thank you.
Thank you, John. Up next, we have Deborah Smestad, the Auditor Treasurer of Ward County.
Hello. I guess there's been some confusion and some concerns about the election, so I'm here to try to clarify some of this. So in the next several days, if you haven't already received your ballot application, you will be getting one, and it comes and they're highlighted. What our office is probably getting 4 or 5 calls an hour since these came out because the top is confusing. So I'm gonna just walk you through. So you have the June primary election to check, the November general election, you have all state election, and then off to the side here you have the city, school, or any special election. So if you only want it for this June election to get an application and a ballot for absentee voting, you would only check the June box. If you want all state elections, whether it's be the school, the county, the state, any special election that may be happening in 2020, then check the box that has all state elections. If you check this box, rest assured you will be getting a ballot in the mail come the general election as well, so you won't go to the poll then either. And then if you want just the June election and a school election, then go ahead and check those 2 boxes. And we are scanning every application that has school or all state elections and sending those off to the schools. So the schools that are having their own election will also get those ballots out to you right away. And then going down further, it asks for what ID are you using, whether it's a driver's license, a non-issued or a non-driver ID, long-term care facility, or a tribal issued ID. Check one of those, and then we need your ID number below that. And then they're all populated with your current address, or at least the address that we have in our Voices system. So when you do that, if you have a PO box or an alternate mailing address, make sure that we have that on here as well so we can get that ballot to the address you want it delivered to. And then I can't stress enough, this is an affidavit that this is all true information for you. It must be signed and it must be dated. We are sending back many because they sign it and don't date it. It all has to be complete. So make sure that when they're highlighted, that you complete every highlighted section that's there for you so we can process your ballot and get you the right ballot. Now, when we get your application, you're going to get your ballot with instructions in a carrying envelope that looks like this. And inside that, once you complete your ballot, put it in the secrecy sleeve. And this is just an envelope that doesn't have a flap on it. Just put the folded ballot in that, and then into the return envelope. And on the back side of that return envelope, again, you're signing it and saying that you're qualified and that this is truly your ballot. And we will match the signature on your application to the signature on your affidavit in order to count the ballot within. So those are just the basics of how this is working. And if you want to mail your ballot back, they must be postmarked by the 8th, the day before the election. If you are going to hand deliver, we have 7 places in the county that you can deliver your ballot to. We're at the City Hall in Ryder. The Senior Center has a drop box in Makoti, Kenmare City Hall, Berthold City Hall, Burlington City Hall, Surrey City Hall, and then the library drop box right in front of the administration building at the county here in Minot. So you have several options of getting those ballots to us, and then we do have an absentee precinct. The people have been contacted and hired to process all of these as we would any other absentee ballot in past elections. Thank you.
Thank you, Deborah. Up next, we have Sean Sitma, Mayor of the City of Minot.
Well, thank you. And before I begin, I just also want to thank Deborah and also acknowledge that this might very well be the last election that is conducted that Deborah has done for Ward County over many, many years. I won't lament on how many, but certainly want to thank her for her decades of work through that process, especially given the unique circumstances of this one. So, good afternoon. I do want to say thank you to everyone again that has come out, the media, and of course, everyone that is tuning in at home. North Dakota Smart Restart has absolutely begun, and we now know the governor's guidelines restrict the capacity and preach social distancing and recommend face masks while using various businesses in their capacities to reopen right now. And we're happy to have those businesses' doors reopen and people slowly getting back to some sort of normalcy. But we do need, and I stress need, to take those restrictions very seriously. Otherwise, that normalcy very well could revert back to the abnormalcy that so many of us have longed to say goodbye to. Certainly not wearing a mask in public is your right, but it is also the right for any business to require people coming into their facility to enforce that. So I will ask everyone to respect each individual business's preference with that and continue to encourage people to wear masks when they are out in public. We can almost guarantee that the spread of the disease will continue in the coming weeks. The numbers continue to support that. It is our job as citizens to try to not to let that get out of hand. And I think that we've done a good job in Ward County and across north central North Dakota, as March 11th was the first case that we saw, and since that time, moderate growth. 25 cases in Ward County since that time, and I would like to think that that is because of some of the due diligence and the fast action of people to change, I think, on their daily lives and how they interact in social distance. I do want to talk about a little bit on the enforcing guidelines as moving forward. That has been a question a lot of people have asked. The governor did address some of this in his latest, couple of his latest press conferences as we go into North Dakota Smart Restart. It came last week after I spoke, and I'm sure that many people were excited about this, but also came with that reservations from a lot of folks. As more people ease back into their business lives, those guidelines still do need to be enforced. I've had many people ask how that is going to be enforced. The simple answer to that is we are. Everyone is going to enforce that, mainly for themselves. I think everyone else out in that is reintegrating into these businesses, that we need to be cognizant of that. We need to be responsible for our own actions, and businesses certainly need to be responsible for theirs and follow those guidelines set forth by the governor in the restart. I do want to emphasize, though, if it does come down to it, the police department absolutely will be responsible for holding others to that responsibility. Before anyone grabs their phone, though, to dial in for a complaint to the police department or hit send on an email to file a complaint, I would ask this. There is a lot of new information coming out every day for different businesses, and I think it is absolutely an easy responsibility for any individual who feels that a business might not be following that to simply ask that business if they know what the guidelines are. And if they know what those guidelines are, ask if they're going to be following them. And more importantly, do it respectfully. We've talked about North Dakota Smart. We've talked about North Dakota Strong. We can also talk about North Dakota Nice. I think some of this pent-up needing to get out certainly has got quite a few people on edge, but as we reintegrate and reintroduce, if a person's not wearing a face mask that is required, I think asking people to be respectful is just as important as we go through this next phase of North Dakota Restart. Certainly everything is coming fast, and not everyone does have the information. That information is available on many different platforms and can be gathered, whether it be through the North Dakota Department of Health, First District Health Unit, or even calling the local health unit for that advice. I would also ask that, lastly, if people are aware of a business or individuals knowingly and purposely not following these guidelines, that they let the police department know. Because the last thing that we do want is a major setback within a resurgence of positive cases to undo all of the hard work and sacrifice, not only by individuals, but by businesses, the entire communities, the entire region. I would like to think that that is going to be a worst-case scenario and hopefully the last effort if someone is purposely not following those guidelines. But to know that the police department will respond to that under the North Dakota Governor's guidelines of an infraction. And certainly anybody can go to the North Dakota Department of Health and review those guidelines that were outlined by the governor at a couple of his last press conferences. Thank you again for your time, your effort, and everyone's continued effort to follow these guidelines, their social responsibility as we continue to march forward. And I think adjusting to the new norm and hopefully working faster back to the old norm each and every day. Thank you.
All right, thank you, Sean. And last but not least would be me. Once again, I am Jen Wichman with Ward County Emergency Management, and I just have a few odds and ends I wanted to bring up. The North Central Human Service Center has a reminder for everybody to continue monitoring yourself and others for any concerns you may have with mental health and substance use. If you or someone closer to you is having a crisis, contact 857-8500 for 24/7 behavioral health emergency services. And a little plug for my office is for something called HyperReach, which is our local emergency alerting system. If you're not familiar, what it's used for Ward County in particular, is for alerts for shelter in place, for hazardous material releases, missing children, like we recently experienced with the little boy that went missing off of Valley Street, boil order notices, wildfires from things that happen with our good old burn ban that we have, or at the end of the day, it could be used for public health notices. So to sign up for this, it is an opt-in only service that we have. It's replaced the systems that we previously had. You might be familiar with Code Red or Reverse 911. And to sign up for it, there is a number of things you can do to sign up. There is a website that you can get to through hyper-reach.com/ndwardsignup.html. You can call 701-354-1430 or text the same number. So please, if you would like to opt in your cell phone in particular, your home phone is already opted in if it's in the phone book, sign up for it. Let us give you all of the alerts that are relevant to our community to keep you safe. But last, I would like to bring up a little PSA from the Ward County Public Library. They want everyone to know that they're still here and performing services as needed and as requested. You can reserve books via email or their online catalog, and they will call you when the items are ready, and you can do this through phone or through email or the website. You can stop by to pick these items up after calling or emailing between the hours of 9 a.m. and 4 p.m., and just give them a call and let them know that you're outside. Their book drop is still open if you're returning books. And they also have ebooks, e-audiobooks, e-videos, all available for checkout through Overdrive, Libby, and RB Digital online. So the links can all be found on the library portion of the Ward County website. Their email listed is library@wardnd.com, and their phone number is 701-852-5388. So that's all we have for today. We have 15 minutes ready for questioning. What we're going to do today is start on the right-hand side of the room and work our way to the left. If you've got a question, raise your hand. I'll reach out to you. And with that, I'll start with you, Jean.
Well, I have a few. And you're aware that there's no governor's press conference for us to finish with?
Correct.
Okay.
That's why we are at, 3:08. We do have time, but yes.
All right, I guess I'll just start with a line with Lisa then. Are you wanting us to just do one question at a time?
One question, and we'll work our way back and forth.
All right. We'll just, it'd be nice if we gave a number for the businesses to call if they have questions. That's not my question.
Certainly. So Jean has asked for a number to call. 852-1376 will get you in contact for any environmental health practitioners if businesses, food and lodging facilities have that question. So please feel free to call. We'd love to answer.
Okay, so my actual question is, we have one case in Ward County that was diagnosed that's not in a long-term department has stopped releasing how those cases were contracted. Is that something you could maybe provide us on a weekly basis, about the new latest cases? So like we have a couple of active cases in Ward County, but we don't know if they're community spread or travel and we can't find that out anymore. Is that something the health department can get for us?
I believe that we have that information. Several of those have investigation, I'm sorry.
They don't know what the question is.
The question is Gina is asking for additional information on the status of the cases within the counties. We do have information. Several of those have pending investigations going, any new cases. So once that is identified as a community spread or close contact, that is information that we would have available.
Can we maybe get that email to the media, or do we have, it'd be nice if the media were able to say, hey, this latest case is community spread, or this latest case is a nursing home. That would be very helpful to everyone. Is there a way that we can receive or get that information to all the media?
Jean is requesting that we get that information. I will talk with Lori, and if we are able to provide that and forward that on, we will. Next.
Correction, Jean, you are correct. We are going till 3:30, so we are good there. Moving on to the left.
Sure. Two questions for any health official that would like to speak on this. Is the state backlog of testing kits impacted Minot? And are local health officials monitoring Elmcroft and Minot with those 3 people testing positive, or are they being isolated at all?
Okay, we will have Lisa address that question.
Yes, the backlog at the state and the testing kits that are not available right now does impact our area. We had, as I mentioned, testing events planned and long-term care facilities that we were going to be at this week. I did have a phone conversation with the Lieutenant Colonel yesterday afternoon. They are working very hard, and we are planning to reschedule those as soon as possible. So stay tuned.
Absolutely. There was another, oh, okay, the
Yeah.
Elmcroft.
Oh, that's right, he'd asked about. So I just wanted to clarify too that the backlog at the state with test kits do not affect folks who wish to be tested at the drive-up clinic at Trinity Health. We have test kits available in our supply. We have had test kits available in our supply for weeks and weeks. So those are not impacted, our testing is not impacted by what you've heard at the state level with those mass test clinics.
And just the Elmcroft.
We do not comment specifically on facilities or situations that may or may not have positive cases. However, I will state that whenever there is a positive case, First District Health Unit is doing the case identification. They are contacting anybody that is positive, identifying all of those contacts, and making those recommendations. I'm not aware of anybody that is not following those recommendations at this time.
Except for the governor is saying that they have to be quarantined or removed within 24 hours of identification. I think that's what Ben is after, whether or not the governor has stated many, many times that when a long-term care facility identifies a case, that person is removed from the facility or isolated and quarantined within the facility and not sharing any workers. And I think that's what we're both after. Has that happened at Elmcroft?
I'll just say that all of our recommendations have been followed. And so, yeah, we are consistent in our recommendations with what the governor is stating, and I'm not aware of any situations that our recommendations have not been followed.
Yes. For Susan.
Could you talk about any visa requirements for getting unemployment during this time and how long they will last?
So if you're talking about the executive orders that the governor has signed, at this point, we have not heard anything when those will, be, I'm trying to think of what the right word would be, but when those will be called off. So right now, the work search requirement, that is not, it used to be a requirement, that is still under the executive order, being registered on the employment side of job service. Right now, again, that is waived. So again, we have not heard any talk of when those will be stopped.
Susan again.
Okay, oh, sorry, new to this process, so apologize.
You were very helpful with some of this. One of the things that's thrown a monkey wrench into all of this is the federal pandemic unemployment insurance. That is the extra $600 that gets tacked on to all unemployment claims. Let's talk about what happens to that when a person is called back to work.
So you're asking what happens to the federal pandemic unemployment compensation, the additional $600 that people are receiving while they're on unemployment. So I'll go back to that when I read the excess earnings part. That again, that is in our claimant guide, which is available on our homepage of jobsnd.com under unemployment for individuals and resources for individuals. Page 22 of that claimant guide talks about the excess earnings. So if someone does not receive, if they've made too much money during that, when they're doing their weekly certification, they have earned above their weekly benefit amount, they would not be eligible to receive that FPUC payment.
But if they make even $1
Dollar.
in unemployment,
Correct. They would receive that additional, that would receive the FPUC payment if they make $1 in their weekly benefit amount. Okay.
All right, any further questions?
I had a question.
Randy?
Yes, ma'am.
Actually, I have two. Do you test patients after they've recovered to see if they test negative?
So part of our discharge process includes retesting. Before they can be discharged to another unit or to out of the hospital, they have to undergo a couple of tests.
And test negative?
Yes, and test negative. So the question was, do we have any process in place to test patients before they're discharged, I believe is what you asked. And the answer is yes. They do get retested before they're discharged or moved. Mhm.
Those test results don't wind up in the state results, right? What do you say?
They do not.
Okay. And then travel season, vacation season is coming up. You've got employees going to be taking vacations. Are you still going to be requiring like a quarantine when they come back to work?
Good question. Question was asked, as an employer, and we have associates who might be going on vacation and have travel plans. When they return from their travel plans, what is the employer's stance on return to work? We do have a travel policy that we have in place that does require some quarantine time depending on where you go. So I suggest there are a lot of hot spots today. There were only a few when we first started this journey. There are a lot of hot spots today, and employers would be good to research their itinerary based on where the policy says they have to be quarantined when they get back, because that would not be covered time. So there is an expectation that employee health is involved in those plans, that they are traveling, especially out of state. So again, those policies and all policies basically that we have enacted as a result and a response to this pandemic, including things like visitor restrictions, are being reviewed constantly. So they're subject to change any day. And so we have regular communication with our staff to let them know what has been posted. We have a website for all of those COVID-related policies and procedures, including travel policy, paid time off policies, those kinds of things that might have been tweaked for this event. And they're encouraged to keep up to date with those policies. Also, regular communications by our CEO, Mr. Kutch, and others to let them know of those kinds of things that are occurring. So we have an informed workplace, and they understand and don't get caught up in something that they're not planning for. That answer the question? Yes, sir. Thank you.
All right, any further questions? All right, seeing none, thank you all for coming. We'll see you next week.